Okay, thank you. So, did you know that globally a significant portion of vaccine and temperature sensitive medicines are wasted every year? Not because they are unavailable, but because they are damaged during storage and transport. Yeah, that is true. What's more surprising is that many of these failures happen silently, even when shipments arrive on time and paperwork looks very perfect. I have seen this happens personally in both humanitarian and pharmaceutical supply chain context. In this video, I am going to explain what research tell us about cold chain failures and what actually happens in the field. So let's start. Why this matters? Cold chain management is critical for vaccine, insulin, biologics, and many other essential medicines. For supply chain professionals, pharmacists, and procurement teams, cold chain failures is not just a technical issue. It directly affects patient safety, program credibility, and trust. On paper, most organizations have SOPs, data loggers, and monitoring tools, but in reality, failures still occurs, often unnoticed or ignored. So that is true. So let's explain this concept. Cold chain simply means maintaining medicine within a defined temperature range, usually 2 to 8 degrees of Celsius, from the manufacturer all the way to the patient. This includes international transport, central warehouses, regional stores, and last mile of delivery. The key point is that a failure at any single point compromises the product, even if everything else was done very correctly. Temperature control not about one refrigerator or one truck. It's a continuous system. So what research and evidence says? Now let's look at what research tell us. Global health studies show that a large percentage of vaccine are exposed to temperature outside recommended ranges at some points in the supply chain. Researchers also has found that freezing damage is actually more common than overheating, especially during transport and handling. Another key finding is that temperature monitoring devices are often available. Yeah, that is also true, but the data is reviewed after delivery when it's already too late to act. Yeah, that is a very common and very interesting fact I have found in my time of supply chain. So the issue is not lack of equipment. The issue is how systems respond to temperature data. So here are some field examples that are going to help you from my experience. Let me share a real field experience and example. In one operation I worked on, vaccine arrived at the warehouse on time with complete documentation and intact packaging. Everything looked very compliant. But when the temperature data logger was reviewed after delivery, it showed exposure below 0 degrees Celsius for several hours during road transport. The vehicle had not been properly preconditioned, the data logger was checked too late, and there was pressure to accept the shipment due to the tight program timelines. On paper, the shipment was compliant. In reality, the product quality was compromised. That is a true fact. So, key takeaway: cold chain failure is rarely a technical problem. It's a governance, behavioral, and accountability problem. If you work in health supply chains, remember this one sentence: a temperature excursion ignored is a failure accepted. In future videos, I'll continue sharing real field lessons from pharmaceutical and humanitarian supply chains based on evidence, not theory. Thank you for watching me.